camera off because of some bandwidth issue where I am. So I'm still facing some network issues. Okay, so is Mr. Debnath has joined, and okay, great.
I have joined.
All right, all right. Okay.
Pankaj Rai
Yeah,
Gupta.
I can see Mr. Pankaj. Yes, yes.
Yeah.
Okay, so welcome everyone. This is the first module and the first class of the certificate course of Artificial Intelligence in Medicine. Uh, so what we are going to do is I'm going to start with the first module straight away. And I also presume that there are some of our participants and candidates have joined for the first time today. They were not present in the inauguration and the orientation session. So at the end of the lectures today, we are going to also have an introduction with all of you. So just you can identify yourself at the end, and we'll love to know you. So without wasting time, we are delayed by about 10 minutes. Apologies for that. Let me start my presentation. Somebody please confirm me. My slides are visible.
Yes, yes.
Okay, great. Yep. Okay, so in the first session today, we're going to have an introduction to artificial intelligence. And in this, what I will be talking to all of you over the next 1 hour is the basic concept of the fundamentals of artificial intelligence. We will look at how it has evolved. We'll try to understand what exactly happens behind the scene in most AI models, some of the basic intricate details. We'll take a look at the history and we will see how healthcare can evolve with artificial intelligence. So that is the context which I will be talking about over the next 1 hour. And going forward, Professor Roy Gupta is going to give you an overview about the use of big data and its analytics and its use in healthcare. So this is the context of today over the next 2 hours. What I will request all of you to do is you don't need to take any snapshots of the slides or you don't need to record anything. You will be getting the whole recorded lecture on the learning module system. So this is a Sunday evening, be relaxed, just listen to it. While we are delivering the lecture, let's try to use a couple of housekeeping rules. I will request everybody to keep themselves on mute. But at the same time, in between the lectures, whenever you have any questions or queries or comments, please put it in the chat box. Do not hesitate to communicate with us on the chat box. I also believe that some of our other faculties have joined in. So I can see Dr. Alok has joined in. I can see, I probably hope that Avnish has joined in, the course coordinator. So if there is any instant responses that can be given, our other faculties are going to respond to you. Or even in this module, Professor Pankaj can also give you the response over the chat box while you post it. But whatever comes to your mind, keep on posting it in the chat box as a question while the lecture is on. And at the end of my lecture, I will get back to all those questions individually in the chat box. And likewise, Professor Roy Gupta will do the same. And then after the end of both the lectures, we're going to have at least a 15-20 minutes of brainstorming, question answer session, whatever way is convenient to the batch. Right. So with this, let's get on with it. And let's have an introduction to artificial intelligence. Now, as I believe, most of uh, our participants in this batch are naive to the concept of AI, but there would be some of you who are possibly into an advanced stage of learning. Some of you are also coding, as I've understood from the introduction the other day. So the introductory sessions might be very simple for most of you, but at the same time, it's important that we have a revision for of everything and for the learning of all in common. this introduction is going to be kept in a very simple way for everyone to understand. So now we are trying to understand what artificial intelligence is, as we understand it's a segment of computer science which is mainly concerned with automating intelligent behavior. Now, these two terms are very important because you're looking at automation and you're looking at another term called intelligence, right? So, as we say, it's artificial intelligence, so it is automation of intelligence. So, it is the ability of the computers to do things that would require intelligence if done by humans. Before we go and understand the focus of artificial intelligence, we need to understand in today's session about what is intelligence. And this is something that humans possesses. So the way we want the artificial intelligence to be is the way we consider ourselves to be intelligent. So intelligence, as you can see in the slide, is perceive, analyze, and react. These are the three segments of intelligence. So intelligence is usually defined as a group of abilities, which means understanding, learning, reasoning to make decisions and to solve problems. And each of these is what an AI tool does for you. It understands, it learns, it reasons, it either is an autonomous way of making decisions on its own, or it helps you in your cognition and helps you in making decisions, and it helps you in solving problems. So AI will emulate these aspects of human intelligence with the help of a number of tools. Now, when you look at intelligence, there are various types of intelligence that we are looking at. So as I said, intelligence means to understand, to calculate, to reason, to perceive relationships, analogies, and then learn from experience. This is very, very important segment of an AI tool, that it can learn from experience, store and retrieve information from the memory, solve problems, comprehend complex ideas, and also use natural language fluently. That's also a very important segment of human intelligence. Classify, generalize, and adapt to new situations. Now, in this slide, you can see there are various types of intelligence which a human being actually possesses. As described by Howard Gardner, who is an American psychologist, he believes that intelligence comes in multifolds. One is linguistic intelligence, something which we all possess, right? What I'm doing at the moment is giving a lecture or an oration. So this comes with my linguistic intelligence. Musical intelligence. So the ability to be creative, communicative, understand meanings of made with sound, understanding of pitch and rhythm. This is where your voice response comes in the AI system. Then is the logical and mathematical intelligence. So it is the ability to understand and use relationships in the absence of actions or objects. Spatial intelligence, this is very, very important. It is the ability to perceive visual or spatial information, change it, and recreate visual images. Other than that, we have the bodily kinesthetic intelligence, which is also very important. Intrapersonal intelligence and interpersonal intelligence. So one's own feeling, intentions, and motivations, and feelings of other people. So when you're trying to build an intelligent system, you would, in idealistic condition, want it to have all these different forms of intelligence: linguistic intelligence, logical, mathematical intelligence, spatial intelligence, intra and interpersonal intelligence. But then when you try to understand intelligence in a more depth, you're looking at these 5 segments which intelligence is composed of. So what are the components of intelligence, right? One is reasoning. That's a big important component. Understanding and reasoning, that's very important. At the same time, learning. So reasoning and learning goes together hand in hand, and this is how you want your AI system to also work. You want it to reason, you want it to learn and then reason, right? At the same time, it has to perceive. There has to be a sense of perception for it to always give you a nuanced response to the kind of command that you're giving or the prompt that you're giving. You want the AI system to be having a problem solving attitude. So you give a problem, it gets back to you with a solution of the problem. That's how most of your conversational AI model works. And the most important intelligence, which is very important for any AI system to be user friendly and uh, good for adoption, is linguistic intelligence. So imagine when you are able to use an AI system, the only reason being is you have a free flowing conversation happening with the AI agent or with your chat GPT using something called natural language processing. So it should have the intelligence to process natural language the way human brain processes. So this is the component of intelligence that we are looking at. Now let's look at each of these segments of intelligence a little bit more in detail. As I said in the introduction, understanding intelligence is exactly the way we will want the intelligent form of an AI tool to work. So one is reasoning is the set of processes that enables us to provide a basis for judgment, making decisions and prediction. And as you look at reasoning, there are two types of reasoning that you talk about. So inductive reasoning, where you induce, so it conducts specific observations to make broad general statement, right? That is inductive reasoning. And deductive reasoning is it starts with a general statement, examines the possibility to reach a specific and logical conclusion. So these are the two types of reasoning that you look at, inductive and deductive reasoning. Let's look at an example of both, right? So now when you look at in the segment of healthcare, and every time, we try to teach you the theories with me, I'll try to give you the nuances and examples in healthcare so that it's easy for us to relate exactly how these systems are going to work. So now let's take a look at, for example, inductive reason would be an AI system which is analyzing specific patient health data. For example, a data set of patients with high lipids and cardiovascular events to infer the broader pattern. So that gives you a pattern recognition, right? And then it identifies that patients with certain cholesterol level who are at a high risk of heart disease. So what you're trying to do here is you're trying to make the system intelligent such that it can pick up clusters of those patients who has coexistent high cholesterols and they have a high prevalence of heart disease. So that is where you are training the AI tool or the AI model to have inductive reasoning. So, for example, is your machine learning models, which can be used in healthcare for predictive analytics, that is in population health. So that becomes an example of inductive reasoning as in the part of the intelligence which you're uh, allowing the model to function on. Likewise, when you try to look at deductive reasoning, let's take an example here. An AI model has been programmed with the general rule, like if the blood glucose level exceeds 180 milligram per DL after meals, then the patient has postprandial hyperglycemia. So it is deducing certain inference, right? So applying this rule, the system will detect whether the condition in the individual patient whose test result matches the criteria. So this becomes an example of rule-based expert system. And in this module itself, you will understand a little bit more in details about rule-based expert system. So you've seen two various types of reasoning which an AI system can do. One is inductive reasoning. Like example is a machine learning model being able to predict for analytics in population health. And the second is rule-based expert system for diagnosing diabetes complication, where you're setting a fixed set of rule, and based on that, it is able to deduce an inference, which is an example of deductive reasoning. Next is most important. So one segment of intelligence is reasoning, which is very important. The second is learning. Now, what is learning? Learning is the activity of gaining knowledge or skill by studying, practicing, being taught, or experiencing something. And this is that we all do, right? Learning enhances the awareness of the subject, sorry, of the study. And the ability of learning is possessed by humans. And now, of course, with AI enabled systems. So learning is something which you want your AI enabled system to have. So it should learn from practice. It should learn by asking it to memorize something. You teach it, you give it an instruction, you teach it, or you make it experience something from which it learns. Again, what are the different types of learning that we have and that could be applied in AI? For example, auditory learning. So an auditory learning is typically an AI powered voice assistance, right? Which can be transcribing and analyzing the record of the patients during the consultation to provide summary or detect the symptoms from vocal cues. So this is a typical AI scribe. The AI scribes, which are now often integrated with the electronic health record systems which are available, are examples of auditory learning. The second is episodic learning, right? So here, what happens, the AI system will learn by remembering the sequence of the events or the data. So AI system, for example, an AI system is tracking the patient vitals over the time to detect the anomalies such as sequences of arrhythmia. This is an example of real-time data analytics. So it learns from the real-time data and it learns in episodes. Next is the motor learning. The motor learning is example of robots. So for example, you're looking at surgical robots to learning to perform minimally invasive surgeries with better precision, like suturing during a laparoscopic surgery. Observational learning. So you give an example and it observes. For example, an AI model which is trained to recognize and replicate the diagnostic behavior of an expert radiologist by analyzing annotated medical images. So you train the model to function exactly the way a radiologist would function. So it observes, it reasons, and then it learns. And that's called observational learning of the AI system. What else? There are various other types of learning. One is perceptual learning. So here again, you are allowing it to perceive certain things. So it recognizes and classifies based on the previous encountered stimuli. For example, AI system, which is identifying tumors or lesions in medical imaging by learning from labeled data sets of X-rays or MRIs. Relational learning is another example where you are asking it to relate between two entities. It differentiates among the stimuli based on the relationship properties, the relational properties rather
You
than.
want to listen anything? Basic inge va pannu. Come.
Could we request you to kindly mute yourself while the sessions are on? Thank you. For example of relational learning, and one example is artificial intelligence tool adjusting the medication dosage by analyzing patient-specific factors such as lowering insulin dose based on the blood sugar level. So you give a one-to-one kind of an example. You give a relation, and based on that, you are able to sort of ask the AI system to learn. The next is spatial learning, and spatial learning is very important, which is going to actually be used even in augmented reality and virtual reality. So an example of that is AI creating 3D maps of organ structures from CT scan to assist the surgeons in the preoperative planning. This is something which will be uh, the next thing that you will be seeing over the years. And again, there is another thing called stimulus response learning in AI. That is, it responds to a specific stimuli. So what could be an example? A wearable device which is sending alerts when they detect a drop in oxygen saturation, and it prompts immediate medical attention. So this is an example of stimulus response learning. Sorry, just allow me to stop sharing, yeah, and reshare. Are the slides back?
Yes, sir.
Yes, yes.
Great. Okay. So from learning, let's move on to the next section of intelligence, that is problem solving. Now, this is where you want your intelligence system to be most effective and most useful. So, what do you understand by problem solving? It's the process in which one can perceive and tries to arrive at a desired solution from the present situation by taking some path, right, which is blocked by known or unknown hurdles. And this is exactly where you want your AI system to be most useful in augmenting your problem solving capability. So, problem solving actually also means decision making. Now, how how much of a decision-making capability you want your AI tool to have, that will totally depend upon the user and the maker, right? So this is why this kind of conceptual learning is important for us as we start the building blocks of AI learning. So let's take an example. Example is an AI-powered diagnostic system like the IBM Watson Health, which can analyze a patient's medical records and symptoms and suggest a potential diagnosis and recommend the best course of action even when faced with ambiguous or incomplete data. Another example of AI diagnostic support is a Glass Health, which has been built by a Harvard pass out. And I'm sure some of you must have explored using Glass Health, which is again a clinical decision support system where you can put in some symptoms and it can help you, it can predict and give you some kind of a differentials and provisional diagnosis and a line of treatment for that particular patient. So it's the model has been trained on problem solving and decision making, and that's where it comes from. The next part of intelligence is perception. Again, what is perception? The process of acquiring, interpreting, selecting, and organizing sensory information. Now, we can perceive, humans can perceive, we know this very well with the help of our sensory organs. In the domain of AI, perception mechanism puts the data acquired by the senses together in the meaningful manner. So there should be senses and there is data. And when the data is in the senses, then it's going to be able to give you a good perception of things. So example is an AI-based computer vision system which could be used in dermatology to interpret and analyze visual data from the skin images to detect and classify skin conditions. And one of the most commonest skin condition which has fantastic application in AI is the detection of skin melanoma, right? By combining the data from the sensors and applying advanced pattern recognition technique. So it's very important that when an AI tool is functioning, each and every segment of the intelligence is enabled and it has. And this is where the basis of intelligence in an AI tool comes from. Most important segment is the linguistic intelligence. And that is the ability for one to use, comprehend, speak, and write the verbal and written languages. It is important in interpersonal communication. In fact, this is the most important intelligence which enables all of us to use artificial intelligence right in our fingertip. Had it not been important, had this not been there, had linguistic intelligence or natural language processing not been there, probably each of us would have first had to learn coding before you start interacting with a conversational AI model. So this is a tool, this is a segment of intelligence which actually enables and even a person with no computer knowledge to start using an AI system. So this could be an example, could be a chatbot, something which we had created at Doctor's AI, like Madhu AI, which can interact with patients and understand, and it can respond to the verbal and written inputs in natural language. Or like, for example, your chat GPT. Any of your tool that you're using, your Grok, your chat GPT, your DeepSeek, which all of us have been exploring over the last 1 week, which can help an individual. Let's say now in the context of healthcare, it can help a patient understand the symptom, assist them in symptom checking, provide guidance on whether they need to seek further medical attention. So a patient education chatbot. This is where linguistic intelligence is going to play a very important role. So to sum up intelligence, let's try to understand the difference between human intelligence and machine intelligence, right? Again, remember, as human intelligence, largely it is perceived by pattern. So is machine intelligence, but with in most contexts it is perceived by set of rules and data. Having said that, beyond rules and data, and our AI model can have the capacity of self-learning, and we will come into those segments of machine learning as we go into deeper and deeper into the segment. Now, what does a human mind do? We store and then we recall the information by patterns, right? For example, what we have learned during our medical days, we store and then we are practicing, we try to recall that information back in typical patterns. The same thing is done by machines only in the form of a searching algorithm. So it's the same way it works. It just uses an algorithmic approach of retrieving the information from the data. right? A human intelligence can figure out complete object, even if some parts are missing or distorted. Well, machine still can figure out. This may not be fully true, because now even a machine, even if you give a half-baked or a half-cooked instruction, it can pick up with that level of perception. It can pick up and it can give you a full response answer. So this is where the machine intelligence is getting better and better with each day, and we are shifting from narrow to general intelligence. We'll come into that segment. Let's look at the other segments of intelligence. So you have learning on one side and you have cognition on one side. Now, this is very, very important for us to understand. We learn and then we act on it. We act on the learning. So the process of knowing and perception, that's what cognition is. And then there is an overlap of knowledge. So learning, cognition, and this is an overlap where we are looking at knowledge is somewhere in between. So from learning, we are going towards enacting with it, that is cognition. Now, this is where you want your AI system to learn, to have the knowledge, and to help you with a better cognition. If you have an AI system that can autonomously function with a good condition, then probably you're looking at the era of general AI. Right? What about decision intelligence? So you're asking the model to understand, to think, learn, again understand, think, and this goes on in a vicious cycle. And you find this kind of action in most of the tools which you have used in the form of your generative AI tools, because it understands the context, it thinks, it responds, it gives you a personalized response again by learning from it. And each time you're giving a prompt, it learns from it through reinforcement learning, through fine tuning, and it gives, again, understands things and gets better with each and each every day. So that covers the segment of intelligence. That covers the introduction to intelligence and understanding of intelligence, as I believe that before we explore artificial intelligence, understanding intelligence is very, very important. Now let's get on to the next segment. And the next segment is understanding the shift from data to intelligence, right? So data to intelligence. So there are a lot of steps, okay? So when you give a set of data to an AI model, it immediately does not become intelligent just by looking at it, right? So there is a step and step approach that happens. So from data, it has to get converted into information. From information, there has to be knowledge. That knowledge has to be understood with each level of intelligence happening. And there, from understanding, there is a level of wisdom. So data, you grasp the relation of the data, you get information. From the information, you pick up the pattern, and that gives you knowledge. From the knowledge, you start reasoning with it to understand it. And with the principles, you gain wisdom. This is exactly how humans become, wise, with the knowledge, with the data, with the information that we keep on getting since our birth. And this is exactly what the way we want the AI system to also mature and develop its intelligence, right? So again, a very important segment of this data into intelligence continuum is to understand this pyramid. So from data, what is data? Data is unorganized facts. For example, weight of an individual. That is an unorganized, just numbers, right? Strings or numbers. That's data. What is information? It is the analyzed data. For example, mean weight. So weight is your data. Mean weight is the information, right? Now, what is knowledge? It is the interpretation of the information. So, for example, you have weight, you have the mean weight, and from there you are understanding, you're developing a knowledge that obesity is a problem and it's prevalent in the community. So, what do you do about it? Right? So, from the knowledge, the actionable insights, that is intelligence. So, we know if obesity is a growing problem, it's a growing metabolic disease, prevention and cure is the best way. You need to control obesity so that you can control all the other segments of metabolic system, of the metabolic syndrome. And what is wisdom? It is the tested intelligence. So it means that prevention is better than cure. You can prevent obesity, you can control obesity. It is the mother of all metabolic disease, so that individual doesn't get diabetic, hypertensive, dyslipidemia, etc. So this is what the data to intelligence continuum data to wisdom, rather. Wisdom is at the top of the pyramid. And overall, you're looking at data in the AI system, in the AI integrated system, you're looking at data to intelligence continuum. And over the sessions, over the modules, this will be referred to multiple times. While we will be taught on data science, we will be told about data analytics. This particular segment is going to be elaborated and highlighted repeatedly. So now what I want all of you to do is, as I always say, that just listening to lectures are always boring. So I want all of us to get interactive. So now what I want you to do is take out your mobile phone, and you can see this QR code, and there is also a link, as you can see on the screen. Just give me a second to activate this. And I want everybody to start scanning this QR code. Once you scan, this question will appear on your screen in some time. Okay, just scan this, just scan and keep it. Allow me to activate this. Once this is active, you will get it. And once the question comes, I want any one of you to just let me know whether it is live. Okay, just allow me a second. Yeah. So, great. So I can already see answers coming in. So now this is the question, and the answer is, you've got 4 options. This is an anonymous quiz for all of you. This is not an assessment, right? So this is just to get us interactive. Okay. The QR code is there on the screen. Scan the QR code, and I want response from each one of us. I think we have 34 candidates in the batch. So let's have response coming in from each one of us. Okay. So all you need to do is just scan the QR code once. And after scanning the QR code, just keep the page open on your mobile phone. That's all. Do it from your mobile phone, so your computers will stay for the presentation. And answer the question. So the question we are asking is, which of the following best defines artificial intelligence? So the first segment, we had defined intelligence and artificial intelligence. So what is the definition of AI? This is a very simple question. The option was, is it a subset of robotics used exclusively for automation? Answer B, simulation of human intelligence in machines through learning and problem solving. Option C, a type of machine that can only process numerical data. And option D, the ability of machines to perform basic arithmetic calculations. So I could see that there is a 100% response of B coming in, but I'll still wait. If anybody is having a problem in answering the questions, they can let us know. We'll wait for you. I hope everybody has got the QR. It's open on the screen. Right? Could just one or two of you just tell us that yes, no, give me a verbal response?
Yes.
Great. Okay, so I guess we are all on the same page. Allow me to check. Okay, all of you are writing in the chat. Yes. Joining from mobile, can't scan. Well, just try and keep to get the best experience of the lectures, just come in from a laptop and keep the mobile handy for QRs. So at least when we'll be doing the modules, we'll try to keep it more interactive. Okay, so yes, the answer is what all of you got that correct. So the best definition of AI is a simulation of human intelligence. So now we understand what intelligence is. We want artificial intelligence to simulate human intelligence in the machines through learning and problem solving. Okay, so that's first question. Okay, let's try to see if we can do the next one. Wait. Okay, so let me activate it. Yes, I will not show you the response right away. We'll come to the response. Now, this is the question, and I'm waiting for responses to be recorded here. And I think it is already active. Yes, I could see 4, 5, 6. Okay. I'll request all everybody to participate. This is an anonymous quiz. It is just to uh, make sure that we are with you and you're with us in the understanding of what we are trying to. Okay, 9 responses. Can we have some more response? Everybody participate in this. So let's understand the question. Which type of reasoning is applied when an AI model generalizes conclusion from specific patient data? I have 16, 17. I'm expecting more responses. How many we have joined? 34 participants are joined. So we are halfway. I'm requesting everyone to participate in this quiz. We'll wait. Professor Gupta, if you're there with us, you want to shed some light. Don't tell them the answer, but shed some light on those 4 types, on those types of reasoning that we have spoken about, deductive and inductive reasoning from your point of view.
Yeah.
Yes, Professor Gupta.
Let's, generally when we do the deductive reasoning, so we look for the logical process in which a conclusion is drawn based on some general premises to know. And there are multiple ways by which we do this deductive reasoning. We go from a general to specific, or maybe to have a very clear logical certainty. And then we take the conclusion from that. So there are multiple ways, and that way we take the deductive reasonings.
Yes. Okay, so we have 17 people answering now. Let me see the response. 18. Let me see what all of you have got. Okay, so there's
56.
obviously abductive reasoning is something which is abstract. So that was just to confuse you. But analogical reasoning, well, the confusion is between deductive reasoning and inductive reasoning now. Do you want to clarify to them, Professor Gupta, and continue what you were saying?
No, I was just talking about the deductive reasoning. Deductive reasoning is basically a logical process. In that a conclusion is drawn based on certain general known facts. And generally it happens always with the top-down approach.
Yes.
And so there are certain attributes, I think we can also take, maybe later, that how with certain examples of using this AI application in the healthcare sector, that how this top-down approach can be used using this deductive reasoning models. So that's my views. You can continue, sir.
What about inductive reasoning? What is your view on that, sir?
Let me Dr. Dey. Anybody would like to say something, or should I speak?
Yeah, please. No, I was this was
Generally,
good.
inductive reasoning is again a logical process where we take some conclusion based on certain very specific observations and patterns. Okay.
Right.
And if you compare with the other, the reasoning, inductive reasoning is from bottom up. So bottom up is we observe, and how we observe from the data. Whereas in the deductive reasoning, the approach follows from top down. So this is the basic fundamental difference between, the inductive reasoning and the, deductive reasoning. It is bottom up, and it is based on the observations and or the patterns. Yeah.
Right. So now the question was, which type of reasoning is applied when an AI model generalizes conclusion from specific patient data? So now I think from the explanation which Professor Roy Gupta has given you, I think 35% of you got this correct. It is inductive reasoning. So when you're looking at specific patient data point, remember I give you an example of, let me get back to the slide of deductive reasoning and inductive reasoning. That'll be easy. It'll be a quick recapitulation for everybody. Yeah. So remember the example which I gave you is an AI model which is programmed with a general rule or a specific rule, right? So it is like if the blood glucose level exceeds X 180 milligram per DL, then this is postprandial hyperglycemia. So you're kind of that's deductive reasoning. And inductive reasoning is when you're looking at a specific data point, that is high cholesterol and cardiovascular event. So from two specific data points, incidences of cardiovascular event and incidences of high cholesterol, you're trying to induce an understanding about a positive correlation between the two, and you're trying to pick up a cluster pattern that, okay, individuals with high cholesterols are ending up with more MACE or major adverse cardiovascular events, something like that. So that is inductive reasoning. And deductive reasoning is, in this case, you're giving a specific rule or a specific set, like the top the from top to bottom and the bottom to top approach, which Professor Roy Gupta has explained.
Yeah,
so when
very
you're
clear.
looking at yes, so when you're looking at specific set of data points, right? Not a general instruction, like if this is this, then this is this. It's a specific data point, like cholesterol and cardiovascular events. Then that is inductive reasoning. When you're looking at general set of data points or general rules, then that is deductive reasoning. So we purposely kept this because this might be a little confusing for us to understand sometimes how inductive and deductive reasoning works. But this is very important because, as I said, as doctors trying to understand AI, it is not about just how they function, but also how they think and how they function and how they reason. Because if you cannot understand the reasoning in which your AI tool is giving you the response, then you will not be able to tame it and use it effectively. So this is where this basic knowledge is very, very important to all of us. So I hope you all like this exercise. We'll keep doing this in between the sessions so that it keeps you awake and it keeps you intrigued. But we'll request more participation. This is not being marked. You're not going to be judged, and it's anonymous. So we do not know who is responding to what.
Correct.
All right. Let's get on with it. So now 2 questions. Now we'll go to the next section of the learning. Okay. Now let's go to the next segment of human-machine intelligence continuum. Now, there are 3 definitions. We need to just understand them. One is assisted intelligence, one is augmented intelligence, one is autonomous intelligence. So assisted intelligence is when the machine performs tasks that are automated as the tasks do not change and do not require an interaction with the humans. Like, for example, a robot functioning, right, in a factory. So that's a kind of an assisted intelligence. Augmented intelligence is there is an active ongoing interaction between the human and the machine. So both the machine and the human, they are informed and they learn from each other. That is what machine learning is. So augmented intelligence is actually another terminology that is often used for artificial intelligence, which we most commonly used in our ecosystem. And lastly is autonomous intelligence. Now that is, for example, an autonomously driving vehicle, right, which involves an automated decision decision making by the machine, with the machine learning continuously. So there is a loop of learning, reasoning, understanding in that, and it is learning and it is functioning in an autonomous manner. So this is another way of classifying machine intelligence, and that's again, you can look at the human to machine intelligence continuum. So this is a few of the examples. As I said, assisted intelligence, for example, you could have robots working in a hospital. Augmented intelligence is where the machines and the human make collaborative decisions. And this is the kind of AI system that we want to work with, like an augmented intelligence system. Like, for example, there was the Watson for oncology, and the autonomous is where you can ask the machine to take independent decision. Now, for example, the fundus scan, which are done using the retinal images are taken, and using deep learning, you have the annotations done, and it predicts that whether the individual has retinopathy or not. That is an example of autonomous intelligence. Okay, I think this is something we have all heard about, the Turing test. This is very, very interesting. So I'm not sure how many of us know about this. This particular test is was performed by Alan Turing in 1950 during his paper, and it was designed to empirically test machine intelligence by comparing it to human behavior. So what was the exactly Turing test game setup? So a machine and a human will be placed in separate rooms. There is a third participant who is an interrogator, communicates with both through textual interfaces. Now, if the interrogator cannot reliably distinguish the machine from the human, then the machine is considered to be intelligent. So this was the Turing test. What was the evaluation process? The interrogator asked a series of questions via computer terminal. The machine attempts to imitate human-like responses. Well, it had a lot of limitations, but in the 1950s, this was one of the best way of assessing machine intelligence. And now with the era of general intelligence coming in, obviously the Turing test doesn't hold true anymore, right? So this was the Turing test, which was first proposed by Alan Turing. So there's a huge history of development of artificial intelligence. As you can see, AI is not new. So I have enumerated the entire history. As you can see, the history started with Socrates, who seeks an algorithm in 400 BC. So that's how old intelligence is, and humans trying to create and emulate human intelligence with the help of machine. And since then, there has been lot of developments happening, the Boolean algebra, the radio networks. In Turing machine, Alan Turing started the Turing machine, where he introduced a theoretical model of computing with an algorithm and data on the tape. Uh, yeah, so that was in the year 1936. And in 1950, as I said, Alan Turing actually proposed the Turing test to assess machine intelligence. So this was a time when machine intelligence was actually being evolved and people were trying to get into that segment. ENIAC was the first general purpose digital computer that got created. Something very interesting happened in the year 1956 in the Dartmouth conference, where John McCarthy had organized a conference, and he was the first person to coin the term artificial intelligence in the year 1956, 1957, right? Then you had GPS coming in. That was another development of intelligence system, which is the GPS, universal problem solving machine. So that was another development of intelligence coming in. So when you talk about artificial intelligence, we are not necessarily limited to meaning only machine learning and deep learning and generative AI that we use today, but there is a history of AI on which it has developed. And it goes on. As you can see, this is the whole list. I'll give you all of you the whole list to look at later. And after that, there has been the era of machine learning and deep learning coming in, but in mostly you will see there were two AI winters where not much development was happening, and that was predominantly in this particular phase. Couple of very important developments which happened was 2014. It was the development of GANs, which is generative adversarial network, and uh, 2015, this is what actually shook the world, where DeepMind's AlphaGo defeated human Go champions. And that showcased for the first time deep reinforcement learning. So now you understand when you say reinforcement learning, how that learning exactly happened and what form of intelligence we are actually talking about. So since then, there has been the era of more and more deep learning, machine learning being developed. And finally, if you look at the recent years, the years since when we started talking, since 2022, largely is where you had the era of generative AI. And as we speak of 2024, you are looking at more of the era of agentic AI and AI assistance. Now, this is what we will be working with over the years to come. So emerging AI trends in this year and beyond, A is multimodal AI models. This is something that we had experienced since 2023. You had multimodal chat GPT coming in, multimodal Gemini coming in, which combines text, image, video, and sensor-based AI for advanced reasoning. As we go into 25, you will be finding a lot of agentic AI systems coming in. So here, AI will be capable of independent decision making with self-improvement capabilities. You're looking at autonomous functioning of the AI agents. We are seeing use of AI in healthcare. That's what the whole course is all about. And you will also be seeing development of quantum AI. This is a topic that we will be covering separately in one of the modules because we believe that this is a segment that will really be evolving. And in the next few years, you will be seeing, with so much of potential AI models coming in, you'll be seeing a lot of governance coming in. So global policies on AI ethics, safety and fair use of AI, transparent use of AI. Some of the topics will be covered by our speakers, by our faculties in the upcoming modules. Let's move ahead. The next segment. What is an agent? And let's try to understand an agent in an environment, right? So an agent is anything that can perceive its environment through sensors and acts upon that environment through effectors. So it has effectors by which it acts, it has sensors by which it senses, just like we have our sensory system and our motor system. That's exactly how an agent functions in response to an environment. So a human agent has got sensory organs. As we all know, we are all doctors. A robotic agent will have cameras and infrared rangefinders for the sensors and various motor and the motor functions for the effectors. A software agent will have encoded bit strings as it programs and actions. So any kind of a tool you look at in the ecosystem, whether it's a software or whether it's a hardware, it will act in this concept of agent and environment, and the agent will respond to a specific situation in the environment. That's exactly what we do as human beings as well. There are various types of agents and environment that we just need to understand and just try to have a overview of. One is simple reflex agents, which are basically condition action rules. One is goal-based agents. One is model-based reflex agents, and one is utility-based agents. So let me give you one snippet line for each. So a simple reflex agents is one that responds to a predefined conditions. So you define a set of rules, and based on that, it's going to act and it is going to respond. A goal-based agent is where it uses internal models to make decisions. So internal rules are set. It has been given a goal to act on, right? And based on which it is going to act. Model-based reflex agents is it acts to achieve specific objectives, like it acts in a reflex manner. Sometimes that's what we do. We have an action, a condition action rule is there. We use our internal goals, but at the same time, we respond to the external environment based on certain changes, and uh, we we act to achieve some objectives, right? So that is model-based reflex agents. And lastly, utility-based agents are the ones which optimizes the decision based on utility function. So how happy am I by doing this action A? So it has to have an objective and some utility function. Based on this, I'm going to act. So this agent and environment is very, very important because again, in the whole uh, development of the AI models, especially the transformer models and the foundation models, you will find a lot of interactions happening in agents versus environment and uh, in between the two. Now, what are the different types of environments that can exist? For example, discrete and continuous environment, right? So discrete, like it's a clearly defined step-by-step situation, like diagnosing based on a checklist. So it's discrete. Continuous, fluid, ever-changing conditions requiring constant observation and action. For example, managing blood glucose in critical care. So that's a continuous environment, consistently changing. The environment could be observable or partially observable. Observable environment is an example where imaging studies like X-ray with complete report. So that's an example of observable environment. Partially observable, only partial information is available and clinical judgment or further tests are needed, right? For example, the way we do, right? We when you have an autoimmune disease and you need to diagnose it, you look at, you're taken by very limited diagnostic criteria are there, and you are mostly driven by your clinical wisdom and clinical knowledge, right? Your environment could be static and dynamic. Static is where the condition remains unchanged while you make the decisions. For example, interpreting lab results. Dynamic, it evolves rapidly, it requires real-time adjustment. This is exactly what we do when you are managing sepsis in the ICU, or when you're managing a patient who's been just attending the emergency or the acute medicine ward. You are dynamically changing your decisions based on the changes in the environment. Your environment could have a single agent or a multiple agent actions, right? So there could be a single agent who is a primary stakeholder, like in this case, for example, a physician taking routine checkups, or it could have a multiple agents involved, like a team member managing a complicated disease like a stroke patient requiring neurology, cardiology, and rehab input. Right? We all do this. This is why we all exist in the ecosystem, and this is the same thing that emulates in the AI ecosystem as well. You could have accessible and inaccessible environments. Accessible environment example is like EMR system which you can access. Inaccessible is, for example, the data is fragmented or unavailable, right? In that case, you may not be having access to it. Your environment could be deterministic or non-deterministic, right? Deterministic means it could have a predictable outcome based on known data and treatments, or it could have an uncertain outcome and it could have influence of various factors, which is non-deterministic. It could be episodic, it could be non-episodic, right? Episodic example, cases handled at one at a time without dependency on the past events, right? Non-episodic is long-term care involving cumulative decisions. So each of these environments, when they're fed into a clinical decision support system in the context of healthcare, will actually be impacting the way the agent responds to that environment. And understanding this ecosystem is very important as doctors and clinicians when we will be working with these AI environments together. So moving on to the next segment of my talk, what are the goals of artificial intelligence? One is to emulate human intelligence. Now, when you say emulate, now you understand it means understanding the human cognition and then simulating human-like reasoning. Then developing practical AI tools, right, for automating tasks, for enhancing efficiencies. Most important goal is problem solving capabilities. That's what we want our AI, a good AI system to work, and it should have a good decision making capability, and it should be able to handle complex computations. It should be able to create autonomous system. Eventually, a goal of any AI system is to be autonomous and self-learning. That's more important. That's where robotics and automation will come. Therefore, we as doctors need not fear that one day an AI tool may become more intelligent than me, because by the nature of its development, it is bound to happen that someday. Most importantly, it should have an understanding of intelligence. So these are the goals of an artificial intelligence ecosystem overall. What are the roots? In the roots of an AI system, there has to be a philosophy, which is consciousness and rational thought and reasoning. There should be logic and mathematics. Every AI model is built on a logic and mathematics. It should have the base and the root of computation. It should have the root and base of psychology and cognitive science, biology and neuroscience, and it should also have the roots of evolution. And this is what you see in your genetic algorithms or in adapting and learning methodology of the AI systems. Eventually, we will be looking at the phase of artificial consciousness, which refers to the creation of machine intelligence that can rival human cognitive ability, right? And I know the whole discussion of artificial consciousness actually reflects humans' aspirations, at the same time, the human fear regarding the future of AI. And this is why understanding the intelligence which is built in the AI system is so important, because then we will be able to tame it and use it to its right potential to answer our right needs. What are the different subfields of artificial intelligence? One is speech processing, natural language processing. We will be coming into each of them in details as we go on. There is planning, there is engineering and expert system, and there is something called fuzzy system or fuzzy logic, which I will explain today. And there is also the models of brain and evolution. So the brain modeling and the evolutionary modeling, these are some of the subfields of artificial intelligence as you see. Okay, so now the next part is understanding the different types of artificial intelligence. And as I said, we are in the era of narrow artificial intelligence, where the machine is imitating the human behavior, specializing in one area to solve a problem. And we are gradually evolving into the phase of artificial general intelligence, where it can continuously learn, reason, understand, and become as smart as humans. And we are probably somewhere in between this phase at the moment, with AGI being evolved gradually, and hopefully in the next 3 to 4 years, we will be shifting more towards autonomous artificial general intelligence, where whether we will see artificial consciousness, as I mentioned in the last slide, well, that's the stage 3. But as I said, in the evolution of an AI system from here to here and from here to here is bound to happen, because this is how intelligence is supposed to evolve. So from learning to intelligence to consciousness, this is exactly how any intelligence system should evolve. There are various other types of AI. If you look at the different types, one is reactive AI, one is limited memory AI, one is the theory of mind, able to understand the human motives and reasoning, and one is a self-aware. So there are various ways in which we can classify, and mostly we are dealing with narrow AI, with a segment of general artificial intelligence, which is mostly reactive, picking up pattern recognitions and classifications, also being able to handle some complex tasks with limited memory, with depending upon the GPU strengths, and also it should have able to understand the human understanding and motive and reasoning. And this is very important, especially when you're trying to use AI tools in the context of healthcare, right? And these are the different types that we can look at. So let's go on to the next part of our uh, quiz for all of you. Well, just a minute. Yeah, just let me activate the question. Wait. Yeah, I think this question is now active for all of you. Yeah. So which milestone marked the formal birth of AI as a field of study? Okay, so this was from the history section.
Dartmouth Conference.
Yes, what happened in the Dartmouth conference? So yeah, most of us are getting that correct. It was basically, that's where John McCarthy coined the term artificial intelligence, and they say that was the formal birth of AI as a field of study. Right. Let's see the next question. I think all of us will get this correct. This is a question from history. No, we all live with the present, but knowing the history is so important. Okay, now this is interesting. If you have listened to the section where I explained agents and environments, you should be able to answer this question. What distinguishes goal-based agents from simple reflex agents in AI? Take your time. Professor Gupta, you can kind of narrate again your thoughts on agents and environments while our
I think this is the very
participants are
first day
responding.
you have already spoken a lot. But yes, this is the new era of upcoming, emerging AI applications, agent-based. And I'm sure that, maybe after a few sessions, participants, doctors will become fully aware that how this agent-based AI uh, can help us in the future AI applications in the healthcare sector.
Okay,
They
so
make
let's
decision based on long-term objectives rather than immediate conditions. This is one of the important automatic.
okay. Would you like to take them through the answer of this? I think a majority of them feel it is they make decisions based on long-term objectives rather than immediate conditions. I think that's the answer. So I
Yeah.
guess we all got that correct. 85% of us got that correct. Okay, so let's move on. This is the last part of my talk, where we will talk about the different components of artificial intelligence. And as you can see, that there are predominantly 5 important components. One is the expert system, one is neural networks, fuzzy logic, natural language processing, and robotics. And today I will give you just the overview. And as we go into in depth of understanding these, we will be talking more in details. Before that, there is also something that we need to understand, that every AI tool has the ability to understand speech and voice. So what is speech means what is being spoken, and voice is who is speaking, right? So this is very, very important. Voice recognition and speech recognition, right? Which is a part of the learning section of the intelligence system. So now expert system means where there is a human expert, there is a knowledge engineer, and there is a knowledge base, and there is something called inference engine, which is actually somewhere between the user and the user interface. So here you're giving some kind of a rule or some kind of a case, and based on that, from the knowledge base, it is drawing inference and it is giving an output to the user. So there are the three components here. As I said, the knowledge base is important of any expert system, the inference engine, and then the user interface, the UI, that's more important, like your WhatsApp chat UI or the chat GPT UI on which you are interacting with, the user is interacting, that's called the user interface. But before that, there are two layers. One is the knowledge base and the inference engine. And the knowledge engineer will feed the knowledge base from the input of the human expert. Now, try to emulate and understand this in the context of healthcare is we are no longer much using the expert system now in AI, but you're in the era of machine learning. But this is exactly how you want an AI system to be working in healthcare as well. So you want a human expert, give inputs to the knowledge engineer, build the knowledge base, have an inference engine from where you draw the inferences, like what your RAGs do these days. And then you have to have the user, who is the end user, using an user interface to produce the generate the output, right? So there are basically two different types of reasoning that happens in expert system. One is rule-based reasoning and one is case-based reasoning. So rule-based is transfer of knowledge from an expert to a computer based on fixed rules, right? And case-based is which is most applicable in healthcare, is it can find solutions to new problems by adapting previously good solutions to similar problems. And this is where it learns by adaptation, and it learns by reasoning and by learning. Now, there is also something called fuzzy logic, and this is something which is very interesting, and we need to understand this because a lot of fuzzy logic systems are used in the application of medicine, in the implementation of the AI tools, right? So, fuzzy logic expert systems are used for representing in a computer understandable way expert knowledge, but that has ambiguity. So it is not a clear cut yes or no, but it is somewhere in between. So let's look into that in the next upcoming slides. So you understand that an expert system will be capable of advising, demonstrating, deriving a solution, diagnosing, explaining, predicting results, justifying the conclusion, but it will not be fully capable of substituting human decision makers, possessing human capabilities, refining their knowledge. Because these functionalities come under the spectrum of autonomous artificial intelligence, which is now evolved. But the early days, we had expert systems, which is the conventional artificial intelligence. The expert system's knowledge is based on two categories of knowledge. One is the factual knowledge, one is the heuristic knowledge. The factual knowledge is the information widely accepted by the knowledge engineers and scholars in the task domain. Heuristic knowledge is like the practice knowledge, the accurate judgment, and one's ability of evolution and guessing. So, your open source knowledge base, for example, is the factual knowledge. When you are training the model with your own inputs and expertise, that's the heuristic knowledge that you're giving to that particular system. There are two ways in which the inference engine works. Okay, one is forward chaining, one is backward chaining. Understand that we as doctors don't need to know the whole thing, but we need to have an understanding and overview of how these are happening. So this comes in that question mark of how, right? So forward chaining is what can happen next. So fact 1 and 2 and 3 and 4 gives one decision and two decision. So then it gives decision 4. And here it's just backward chaining. Like if this has happened, then this has happened from this decision. And well, this was led by, it happened from these facts. So it follows a chain of thoughts. Now, these days you look at AI systems which follows a COT, as they call it, chain of thought reasoning. And the basis of this is how this inference engine is built in the transformer model, whether it is a forward chain of thoughts or a backward chain of thoughts. And this is how these models keep on getting evolved. In the field of AI, you have seen evolution happening in the field of expert systems. So from case-based and rule-based reasoning, we have shifted into the era of machine learning, where we are really looking at more data-driven precision medicine coming in. So when you talk about AI in medicine these days, we no longer talk of expert systems by large, but they form the foundation actually. And from there, we have shifted into the era of machine learning, which we will obviously explain in detail in upcoming modules. I promised you I will tell you a little bit about fuzzy logic because I believe that fuzzy logic is where a lot of AI models will be working and resembling around. So fuzzy logic is a method of reasoning that resembles human reasoning. So it imitates the way of decision making in humans that involves all intermediate possibilities between the digital values of yes and no. So it can be a certainly yes, a possibly yes, cannot say possibly no, and a certainly no. So the inventor of fuzzy logic, he observed that unlike computers, the human decision making includes a range of possibilities from yes and no. Right? Now let's give an example. So it isn't anything that lies between yes and no comes under the spectrum of fuzzy logic. If this, then that. So that's where fuzzy logic comes in. Now take an example of fuzzy logic in the ecosystem other than healthcare. And I'll give you an example in healthcare. One is air conditioner. This is the whole structure of a fuzzy logic is where it happens. It is given a set of rules. If this, that, there is a layer of fuzzifier where the input comes in. And then there is an intelligent layer and there is a defuzzifier, which where the output goes out. For example, you have an air conditioner, which is automatically adjusting the temperature and based on the temperature of the room. So for example, how does the fuzzy logic system works? If the temperature is cold or very cold and the target is warm, then heat. The instruction is heat. If the temperature is hot or very hot and the target is warm, then cool, right? So you're giving a logic to it. If the temperature is warm and the target is warm, then there should not be any change, right? So this is how the air conditioner works with the concept of fuzzy logic. This is very important understanding the mechanism in fuzzy logic works. Take an example of fuzzy logic in medicine. Why am I talking about it? If any of you have been experiencing the use of insulin pumps, especially the latest insulin pumps, the Medtronics and all the other beta bionic pancreas, they all work under the concept of fuzzy logic. They work on something called control theory, which is a set point theory. But behind them, there is a layer of fuzzy logic which works. So again, the instructions are very simple. If the blood sugar level of this person is this, then give this much dose of basal insulin. If the blood sugar levels have dropped to this, then suspend the insulin in the pump. So this is exactly where the context of fuzzy logic appears. And thereby, with the control theory algorithm and fuzzy logic, an insulin pump will help the individual release insulin based on the blood sugar level, which it's picking up from the continuous glucose monitor, which is told on its particular set of rules. And as a result, it helps in stabilizing and maintaining a good blood sugar control in that individual. So fuzzy logic is where you will find applications in many other systems, in many other devices and softwares, which are applicable in the field of healthcare. Insulin pump is one of the best example where fuzzy logic algorithm is. So you can see here, if there is a glucose, looking at the pump picks up the sugar level. If there is a meal happening, then the indication is, well, give more insulin to make up for this sugar because it picks up the pattern and the fuzzy logic algorithm stimulates the algorithm to give more insulin. If there is a hypoglycemia happening, it asks it to suspend the insulin, the basal dose of the insulin in the insulin pump, right? So this is how these algorithms work. The next segment I will speak about is NLP or natural language processing, and a touch on this understanding of human language by the computer, converting it into its own language and responding back to the computer in responding back to the human in the human language is called NLP or natural language processing. And thereby, NLP combines most important part, which is computational linguistic. And this is where linguistic intelligence comes in. It is rule-based modeling of the human language with statistical, machine learning, and deep learning models, right? And you can see here in the graph, you have neuro, which is the way of receiving and processing the information. You have the linguistics, you have the programming, and it's a complex of all this that gets incorporated in NLP. But this is the most important segment of NLP. NLP is the most important segment of AI because with the help of NLP, we are able to use AI freely in our fingertips or in our hands, as I said. There are various steps, and there is a whole module where I will tell you about the whole details of how natural language processing works, but let's get familiar with the names a little bit. So you have something called lexical analysis, you have syntax or syntactic analysis, you have semantics or semantic analysis, you have pragmatic analysis, and predominantly it happens in these 5 stages. The machine translates, retrieves the information, right? Analyzes the sentiment with its reasoning and intelligence, extracts the information, and then answers your question in natural language to you. So this is how natural language processing works in the system. The last part is artificial neural networks, and giving you just a touch of it. So it's a computing system made up of simple number of highly interconnected processing elements which process information by their dynamic state response to external inputs. This was by Dr. Robert Nielsen, who's the inventor of the first neurocomputer. Now, this would be very interesting to all the doctors. That's why I wanted to touch on this on day one. This is something which is our neural networks, right? It's the human brain. By making the right connections, we have the neurons and the dendrites and the axons. The exact same thing is replicated in artificial neural networks. Artificial neural networks are now composed of nodes which imitate the biological neurons. Okay, the neurons are connected by links and they interact with each other. The nodes will take the input and perform the simple operation on the data through multiple hidden layers. And thereby, through these hidden layers, the output at each node is called the activation or the node value. And each link is associated with different weight. Just get yourself a little familiar with these terms, and we'll take up more in details of ANN in the section of deep learning. That's where we will be understanding this more in details. So what are the comparative parts? You have the biological neural network and the artificial neural network. So your soma in the neurons is node. The dendrites are the input. The synapse, between the two nerves is the weight or interconnections. And the axon is the output. So just mimicking the human neural network or the biological neural network, we have the artificial neural network. That's how the similarities are. What are the differences? And this is where the potential of AI lies, right? As you can see here, the size of the neuron versus the size of the nodes. And an ANN or an artificial neural network, the learning is very precise, structured, and formatted data, right? And the storage capacity is also going to be high in an ANN network, much, much higher than a biological neural network, right? And it can learn parallelly, multiple neural networks can learn parallelly at the same time. This is how your transformer models get so super fast and they get so powerful with the knowledge that it's constantly being fed in from the data inputs, because it is a multiple layer of networks that is learning continuously and simultaneously to produce that response. And this layer of neural networks are nothing but same mimicking of the biological neural networks that we possess. This is how the mathematical look of an ANN is, something that we all should keep this picture in a pattern in your area of neural networks. Just get yourself. So this is how the input comes in, and this is where the activation function happens and the output happens. This will be a familiar diagram that you'll all keep seeing, the model of an artificial neural network that you will see frequently over and over coming in. So this is an input layer. There is a hidden layer, and there the processing happens, and there you have the output layer. Again, multiple variables going in the input layer, then there is a layer of processing, and eventually you have the layer of output, which is giving an example, for example, classification. So this is how a neural network functions. What about robotics? It is the branch of AI which is composed of electrical engineering and mechanical engineering and computer science for designing, construction, and applications of robots. There are robots which operate in the real physical world, and AI programs are operating in computer simulated world, right? So remember one very important thing. Most people have this confusion with limited knowledge of AI. People think AI is equivalent to robot. Robotics is a part of artificial intelligence, and most robotic solutions you will find has agent, environment, sensors, effectors, and they will have an inbuilt AI programming working in them. So you have the whole domain of AI now with you, and you will be finding the application of artificial intelligence in medicine on these predominantly 8 blocks. From what I have told you in the first module, you will find application of intelligence in personalized treatment, virtual health assistant with a lot of natural language processing, a lot of linguistic intelligence coming in there. You will have deep learning coming in, advanced diagnostics in medical imaging. The deep learning and the artificial neural networks will be most useful here. You will have predictive analytics coming in from your pattern recognition of machine learning and the forms of intelligence which we discussed. Drug discovery, as we spoke, will get augmented with AI. Treatment optimization will happen. Surgery will get more optimized with the help of AI and robotics coming into application in the field of medicine. And you will have remote AI monitoring augmenting telemedicine and with the help of virtual reality and augmented reality perception. So you can see the all the aspects of intelligence will be found in the domain of healthcare being applied. I will end with 5 very important slides that why do we need artificial intelligence in healthcare. This is the first reason, but I hope you all know this is a very controversial gentleman, and he said he's been the first person who's always been very skeptical about the the negativism of artificial intelligence. But this is one line and one slide which I love about him, and
मैं
he said
कोर्स
this,
कर रहा हूँ आर्टिफिशियल इंटेलिजेंस का उसका
right. So he says that I think we are moving into a period where,
स्पॉन्सर
for
है
the first time, we may have things more intelligent than us. And as a result of this, we must be able to learn and understand this intelligent form so that we can tame it to the best use of it. Especially in healthcare, we should be in the controller seat. And of course, Eric Topel, a physician, a scientist, also a good colleague, and had the opportunity of having a couple of chats with him. And he is very importantly saying that patients want to be more autonomous than they are not so dependent. So as a result, we have the tools to do that already. As doctors, we must be offering them these tools for better patient-centric care. So the why, the 5 whys. Number one, it will elevate clinicians' performance. So it's no longer the standards of care, but it is more precise and more personalized care. And AI will be able to help us get an elevation in the performance with augmented intelligence that we get. The drug discovery is one segment that will really completely change the paradigm of healthcare, because you will find more and more drugs being discovered in shorter period of time. That's what AlphaFold and all the other models which are working on drug discovery is going to bring in. The most important why is this, because as you understand that now healthcare is going to be not just driven by evidence and data, but it will also be driven by information coming from the data and intelligence being derived out of the data. All that we have been working on and researching on and practicing on is just this tip of the iceberg. The RCTs, the cohort studies, the case control studies. But we've been missing out on this deep section of the iceberg. Artificial intelligence with integrated connect with data analytics, which Professor Roy Gupta will be talking about, will actually help us get more deeper and understand the research paradigm that really is needed with the help of artificial intelligence. Again, this knowledge and information gap is increasing very fast. And from evidence based medicine, we are completely sweeping into intelligence based medicine. So you will find a lot of use of AI in precision and population health. And the most important part, we've spoken about learning to cognition in one of the slide. And as you can see, the cognitive bias codex is one of the limitation of any medical practitioner. We are often driven with the thought by what we experience most or what we see more often. And this often becomes a cognitive bias. So this will help us neutralize the human biases in medicine if used in the right way. And the most important part, as I said, all that we have been looking at is evidence-based medicine. AI, for the first time, with its data, information, intelligence, and wisdom, will look at more data driven, intelligence based precision medicine, which is covering the whole of the iceberg and not just the tip of the iceberg. So, in short, artificial intelligence will help us see what we have actually been missing. Having said that, I will take you quickly to the last part of the poll before I hand it over to Professor Roy Gupta for his presentation on data analytics. And I would love your opinion on this. Which of the following is a major application of AI in medical imaging? The question is on. Sorry. Yeah, the question is now on. Right. Improving diagnostic accuracy through pattern recognition in imaging data. Yeah, so I think that's where we look at more of an augmented use of AI, improving the accuracy of the radiologist and not merely just replacing them. So with this, I will end, and I will end with one very important thought at the end of module 1 from my side is that as doctors today, you've been introduced to a lot of terms, agents, environments, various types of learning, etc., etc., and you might be overwhelmed at the moment. But trust me, folks, in the era of this modern medicine, we need to be bilingual. We have to comprehend these technology terminologies as much as we comprehend and understand the medical jargon. Thank you very much. I will take each and every question that comes up in the chat box. Feel free to ask, and I will now stop sharing and hand it back to Professor Roy Gupta for his presentation on big data analytics.
Thank you, Dr. Dev. Oh, it was a heavy, content-rich session, and I hope all the participants have understood, the importance of AI and the use of AI in the healthcare applications. If anybody have any questions, you can ask that in the chat, or otherwise, because now I have left with only 25 minutes as per our schedule. I was supposed to start at 6. So I need to compress my delivery. So we will not go beyond 7, but maybe 5-10 minutes. And anybody have any questions?
Professor Roy Gupta, I think we'll let you take the lecture and we'll request everyone to post the questions in the chat box so we can continuously take it. And we'll request you to take your time. I'm sure if we overstretch about 15-20 minutes also, I'm sure our participants won't mind that. But we'll love to take your questions in the chat box.
Yeah. Okay. So let me share my PPT. Is it visible? Can you see my PPT?
Yes. Please go ahead.
Right. Okay. So today I'll be talking about understanding the relevance of big data analytics in healthcare. So, in the last 1.5 hours, Dr. D said a lot of things about the use of AI in different applications, machine learning, deep learning, NLP, so many things, agents. But the root of using these applications is the data.
Sorry to interrupt. Just wanted to have one small suggestion. It's been a nice lecture. Can we have just 1 or 2 minutes of tea break or something if people are interested? Otherwise, absolutely okay.
Sure.
I think we can go, Dr. Alok, we can have tea, working tea. People can grab their.
Just a suggestion. I said just a minute break for people to get freshen up between 2 lectures. Whatever you all decide, no issues.
Okay, if you want
I suggest, Professor Gupta, let's go on because we'll lose the flow. But everybody is welcome to quickly grab a cup of tea and come back. And you'll always be there with the recording. So anything bit that you miss, you can always pick it up.
Okay. So my session will focus on the data. So I'm a data man working with the data for last more than near about 30 years. Started with all, the structured data, and today I work on unstructured data and also big data. So let's, try to understand, and Dr. Dey has already said that data is a collection of raw facts and figures. But today, the technology has changed the definition of data. So data is also observations, which is captured with the help of technology, devices, and stored in the form of image, audio, video signals. Now this data, when we store, so where do we store? So there are two techniques. I'll be talking very simple way, and then this will help us in making our base strong, so that when we'll get into the machine learning algorithms or using deep learning algorithms of any imaging related AI applications, we will understand the importance of the second categories of data, which is image, audio, video, signals, etc. But along with this, we also need to use the old data friends, which is facts and figures. Now, today, the technology is helping us to capture large data, large volume of data. And it also helps us in storing those data by using the different technology devices. And we have now high computing infrastructure, we have cloud, and we have on-premise also. I'll be discussing something that the type of problem that we have faced while implementing some of this AI in healthcare applications. Now, when I say data is a collection of raw facts and figures, and it is also observations stored by using the information technology devices in the form of image, audio, and video, etc. So this data can be classified into structured, unstructured, semi-structured types of data. Now remember one thing, when we store the data in the storage device allows us to store the data in two forms. One is called file systems, another is called database system. Most of the hospitals where we use the different type of applications, healthcare applications or patient related data applications, we store the data into the database. Now what is the database? Database is a collections of tables, and today we use multiple databases which helps us in storing the data in a very complex forms. And those complex forms are interrelated with each other with the help of relational database management systems, RDBMS. Other than this RDBMS, we also have a lot of non-database file system data, which is like, we capture data in spreadsheet and so many things. Whereas when you collect the data with the help of certain devices and store the data in image, audio, or video, this goes into a file system data, file system. And today, there are technologies by which this large unstructured data can also be stored using the RDBMS, which is called NoSQL database. Whenever we store a data into a database which is having tables, these are called structured data, and the data can be extracted with the help of a language which is called SQL, structured query language. If the data is not stored in a structured form, then you have to capture the data, we have to retrieve the data using NoSQL. So I'll be talking some of these technologies here as a part of the big data in healthcare. I hope this is clear. So what I said that, so we have data which we are storing either in the file systems or in the database systems. Then why it is called big data? And today, most of the applications in healthcare, it comes under the big data categories. The reason is, once you have a big data, in terms of these 5 V's, what are the 5 V's? Volume, a large, massive amount of data. Velocity, the speed at which the data is getting generated. So when I'm getting more data and I'm storing it, how it is generated? Let me explain you the generation of data. See, generally the data gets generated at the source of any transaction. Now, whenever I'm doing a transaction, the transaction can be capturing some X-ray. The transaction can be, doing some sort of CT or MRI. Immediately the data gets stored. And that data is continuously increasing in terms of volume, velocity, variety. The variety means it has structured, semi-structured, and unstructured data. And at the same time, it also carries a characteristics called veracity. The veracity means the reliability and the accuracy of the data. Another important thing. And it carries a lot of usefulness, which can help us in taking decision making. So this is called value. Now, this 5 V's of data tells us that this is the type of data which is big data. Now, if it is a big data, and if a data is not having this volume, veracity, variety, or value, then it will be called what? This is called either small data or medium data. So we can classify the data into 3 categories: small data, medium data, and big data. Now, if I'm using big data and if I'm using small data, let's suppose a small diagnostic center is using the data and they're storing the X-ray or the other diagnostic related data into different storage devices and also capturing the patient's data, but they are in small scale, so they can handle that in a small storage areas. But if it is a large hospitals or a chain of hospitals, so managing the large volume of data, it becomes a big challenge. Because whenever we capture data, we store data for what? For using the data for further applications. And this read and write, first we write and then we read. And this read-write operations should be such that we should be in a position to use the data in an effective way. So that is why the technology has classified these categories of data as big data, which carries 5 V's: volume, veracity, variety, volume, velocity, variety, veracity, and value. We will explain that in more details. Now, what type of healthcare data can be classified as big data? Electronic health records, medical images, X-rays, MRIs data, CT scan data, genomic data, wearable devices and IoT sensor data, clinical trials and research related data, patient feedback. The patients are giving feedback. I was interacting with the Tata 1mg applications, and I found that, they have such a large volume of data they are collecting from across India, and people are giving a lot of feedback, which is going to the social media. And those are all semi-structured or unstructured data. And then you have health insurance, billing systems. There may be many more. Now, this data, if I consider this data, and if I consider their characteristics with these 5 V's, if they are falling under any of these 5 V's or 2 of the V's, 3 of the V's, then we can categorize them as big data. I hope it is clear. So now, other than this healthcare data, there are multiple other sources from where the data is coming. And these are all stored into multiple storage areas. And that is why the cloud technology is becoming very big. And this data, when I'm storing into the cloud or on-premise storage systems, then the challenge is that how I will use this data. So let's try to analyze the big data in terms of the size. I think all of us know that whenever we capture data, let's suppose if I'm typing 1 or somebody's name, Dr. Gupta. So Dr. Gupta. So how many characters are there? So maybe 10 characters. So 1 character is equivalent to 1 bytes. And 1 byte is equal to 8 bits. Now, if you see this, if I go with this, byte, kilobyte, megabyte, gigabyte, then terabyte, petabyte, exabyte, zettabyte, yottabyte. The way the storage is increasing. So once I come from the terabyte and above, then that segment, that storage of data can be classified as big data. Now I cannot store the data into one storage areas, and that's called, maybe a server. I cannot do that, because if I store that, it will be difficult for me to retrieve the data. But if the data continuously coming, let's suppose the camera is capturing the data in a hospital. There may be 100 cameras, 500 cameras. In medical colleges, I have seen there are hundreds of cameras. And each of these cameras are continuously capturing the data. But are we utilizing the data for any applications? When the patients are, going through the, the treatment process, there are a lot of cameras. In an operation theater, there are cameras. Are we using those data which is captured by those cameras? No, I have not seen such type of application till now. But in India, I don't know. In outside of India, there may be some applications in the operation theater, how the operations is going on, and extracting intelligence that how you can improve that. There may be some processes are going on, but is the doctors will allow to do that? So there are a lot of things where we need to consider. So let's understand this. The type of categories of data we call small data, medium data, and big data. In terms of the size, from kilobyte to megabyte, it is a small data. And we can store and process in a local computers in a small database. So there are multiple databases. For clinical trials, we use some different databases. For hospital management, we use different type of databases. For pharma companies, they use different type of databases. And all those databases, either you can store inside in your on-premise, or maybe you can take a cloud. Now, what are the technologies that you can use? I'm talking about the small data, the second column. You can use Microsoft Excel, some small databases, MySQL, Oracle, or SQL Server, or MS Access. So there are multiple databases that we can use to manage the data. So what is the management of the data? Capturing the data, storing the data, doing some sort of processing by using structured query language, which is called SQL, and then retrieve the data, use the data for doing any sort of analytical application. Now, see, in the analytics world, a lot of times the people get confused, when can't I not use analytics if my data size is small? My answer is yes, you can do that. But I will not be able to use machine learning algorithm or deep learning algorithm there, because my size of the data is small. But still I can use analytics. I can use some statistical techniques and extract the intelligence. I can find out the pattern inside the data. And to do that, if I'm having multiple sources of data which is stored into the different databases, I need to use a concept which is called ETL, extraction, transformation, and loading. And I'll convert that into a data set. And data set is basically an observational data, where each row is the observation and the columns are basically the data points or the data elements. I can have 10 data points. When we will be discussing about some CNN or RNN model on certain applications, I will explain you that how the image data can be converted into a data set with the data points. Now the processing speed, if I take the attributes, fast for manual and batch processing. Data complexity, you can have text data, it is structured data. You can store it in spreadsheet, CSV file, and the data velocity is low. Some of the example is the small clinic patient record, local research data set, doctors personal medical notes, etc., etc. Now, if I come to the third column, which is called medium data in healthcare, so it goes in terms of storage from gigabyte to terabyte. Gigabyte to terabyte, so the gigabyte comes here, which is not highlighted in yellow. And we have the storage for which I will be using some bigger size of RDBMS or database management system, relational database management system, MySQL, PostgreSQL, Oracle, SQL Server. And the data complexity can have structure as well as unstructured, where we have multiple storage of data complexities. And the velocity of data getting generated is medium. Take an example. Some examples are hospital EHR system, insurance claim and billing, clinical trial management. Clinical trial management, we capture data in batches. So the process, the velocity is not that high. Where I come to the big data, because my today's session is on big data, but I wanted to give take you all through that small data to medium data to big data, which will give us a very clear understanding of creating a base for taking all of us to the AI application in medicine. So it goes from terabyte to petabyte or more. It requires a distributed cloud storage or high performance computing. HPC infrastructure, GPUs are required. We need big data frameworks. This is very important, which I'm going to discuss. We need some technologies to manage such type of data. So we use Hadoop, Apache Spark, NoSQL, MongoDB, AWS, Azure. So these are the big data technology framework that we use to manage large data, which has all the V's or few of the V's active. And processing speed, it requires real-time and parallel processing. Real-time and parallel processing, so for AI, ML or large-scale analytics applications. Now, I'll tell you, we have developed an application called NeuroShield, which is used for detecting the brain health, epilepsy, Alzheimer, Parkinson, dementia, depressions. And we use volumetric analysis. We take the MRI scan data, 1.5 and 3 Tesla machines data, and we send it to our AI model, which is loaded into the cloud. And within 10 to 15 minutes time, the patient can get the entire, the report of the brain. Now, this is a system where we are using the big data because we are doing a lot of computation, a lot of analytics using AI, ML and DL also, because we use image data and we use CNN algorithms. And, Dr. B, a few minutes back, he said that, there are 3 layers. So very complex, structure of the models or the algorithms that we use. And then it gives us a very, very around more than close to 90% accuracy level. The data complexity in the big data is the structure, semi-structure, unstructured. So you have medical image, genomic sequence, IoT, so many things. And the data velocity is very high. So you can also do data-driven disease prediction, genomic sequencing, AI-based medical imaging, multiple medical imaging applications. Now, this is the classification of between small, medium, and big data in healthcare. Let's move fast. So now, what I try to do is that based upon the healthcare data, I have classified and highlighted the attributes in terms of their 5 V's. I'll just read out few. The medical imaging, if I take X-ray, MRI, and CT, is a huge per image, 100 MB it goes to GB, gigabyte. The velocity high, continuous scanning if it is happening. The variety is, it is an unstructured data because images are there. Veracity, medium, subject to interpretation errors. And the value, early disease detection and AI-powered diagnostics. So this is the value that data gives. Which data? The medical imaging data from X-ray, MRI or CT. If I consider another example, take clinical trials and research. Large, the large because a lot of samples are taken. So hundreds of TBs, medium in terms of velocity, because a clinical trial goes in batches. The velocity is slow, medium. Variety is structured and unstructured. So when you do clinical trials, maybe in the clinical trials, we do, pathological, we collect pathological data. We also collect image-related data. So unstructured, structured type of data. The veracity is very high. And the value is the drug discovery and the new treatment protocols. Now, if you see these 5 V's and the type of health data which falls under these big data categories, this will help us in taking our decision that what type of AI model I should apply if I'm developing an application considering this type of data. Now, this is a very interesting technology big data landscape. So we have multiple areas like, vertical apps, log data, log data apps. There are different applications which are using log data. Means whenever we do any sort of medical transactions, it also captured the log. It also captured the transactions attributes. So any application that we do for any enterprise or hospitals, you also need to, along with the transaction process, you also need to capture the log data. So today we are talking about data as a service. We are talking about analytics as a service. Currently, I have initiated a project which is called Healthcare Data Analytics as a Service. So we call analytics as a service. So there are different models. In that model, we need to consider SaaS, software as a service, PaaS, platform as a service, and infrastructure as a service. Now, if I combine this and if I provide certain, AI ML models, or, the people from the healthcare domain and the data scientists, they are providing their solutions. So if somebody wants to apply some or use some AI application, they don't have to invest money in terms of setting up the resources. They can go and get the services from an analytics service provider. So healthcare analytics service as a service. So is this called AS? So there are a lot of other things, analytical infrastructure that we need to provide, operational infrastructure, infrastructure as a service, structured databases. So there are multiple structured databases, but all these are managed by big data technologies. If you see the bottom of this called Hadoop, then you have, MapReduce, you have, this HBase, Cassandra, these are the technologies that we use for managing this big data. Now let's try to understand this. So we have Hadoop, we have Hive, we have Apache Pig, we have Apache Spark, and Apache HBase. Now these are the technologies which are used for managing this data, which are big data in terms of their 5 V's. Now I will explain this in, for each of this. Now what is Hadoop? Hadoop, now take an example. Hadoop is an open source framework for storing and processing large data sets in a distributed manner using Hadoop distributed file system. It's called HDFS and MapReduce. Now, what is this? This Hadoop is basically a technology which is provided to store the big data in a distributed file system. Initially I said that, the data is stored in the digital form in either in file system or in database system. Now, if it is a big data and the big data size, varieties, velocity, so I cannot store that into a structured database. So I need to store in a platform which is supported by this Hadoop distributed file system and MapReduce, which is called HDFS. Take an example of this. So if the use of healthcare, it helps to store and process large EHR data, patient history, and genomics data. A hospital network uses Hadoop to store 10 years of patient record across multiple locations. You can imagine, is such a large volume of data. Now, you can also, there are techniques by which you can also calculate that what will be the size of each of a patient data. And based on that, you can also calculate that what will be the infrastructure required. Infrastructure means the platform. And if any hospital wants to do this inside on premises, it is a huge cost. So I was interacting with some large hospital groups in Delhi, in Saket, and they wanted all the applications should be on premise. Now on premise means because they said that healthcare data is very secured. It is correct. But how do you manage such a large complex data sets? You need a lot of investment in terms of hardware and computing infrastructure. Now come to the Hive. Hive is basically a data warehouse system which is built on top of the Hadoop, which allows querying and managing large data set using HiveQL, which is called NoSQL. SQL-like queries. SQL means structured query language. Like I know we write select star means all, from a database table where some condition is there. So I want to collect all the data of all my patients who are male, the age is above 60 and having this particular disease or blood pressure is this. So I can collect all the data by using this structured query language called SQL. But if you have stored the data in Hadoop, you cannot extract that. So what you need a special type of SQL command which is called NoSQL, HiveQL. A researcher uses Hive to find diabetic patients by querying dataset containing millions of records. So, and the data is stored in Hadoop file system in a distributed manner. So collecting the data from the dataset needs certain special type of queries, which is called NoSQL. And you need to use SQL-like queries called HiveQL. Now try to understand about the pig. Pig is a high-level scripting language that simplifies the complex map-reduce job using pig Latin. So this is a scripting language. And how it is used in a healthcare application, process unstructured healthcare data such as physician's note and medical images. If you have captured these physician notes and medical images in the digital form, and the data is stored in Hadoop structure, and you want to extract something, then you can use the pig. The next technology is called Spark. Spark is an in-memory big data processing framework that is much faster than the Hadoop's MapReduce. This is basically Spark is used in a real-time processing where you are collecting the data based on some IoT, patient monitoring data related with blood pressure, sugar level, etc., etc. And on a real-time basis, you can use and extract this data for further analysis, real-time analytics, and you can use the Spark. Now, these are technologies, big data technologies, which are applicable on big data related with healthcare. And the last, this is a very interesting edge base. It's called NoSQL database. It is built on the Hadoop to handle a large amount of structured and semi-structured data in a real-time read and write access, real-time basis. Example, a doctor instantly retrieves the patient's last 10 ECG report stored in a HBase. Now, how do you do that? So you need to use HBase. So generally, when we do this, so we convert the data into HBase, and there are a lot of other, in process, in memory application that we do. and we make the system structure the system, which is called micro analysis, and then based on that we collect the data for further processing. Okay. Now let's try to understand a couple of big data analytics applications in healthcare. So now we have understood the data, medical data can be classified as small data, medium data, and big data. My today's session is talking about the big data and its application in healthcare, and how this big data can be used in the healthcare AI applications in multiple areas. So big data carries this 5 V's, and there are technologies which can help us in converting those data into a smaller form and then take them to the different AI algorithms. I will also speak a little bit about the AI algorithms and how it is done. Now, there are multiple applications which can be used in the area big data analytics healthcare. Some of them are predictive analytics for disease prevention. You can have real-time monitoring and IoT in healthcare applications. Genomic data analysis and personalized medicine. I am connected with the company based in Hyderabad. So they are also doing some sort of this genomic data analysis. There is another area where you can use this is the operational efficiency and hospital management. And of course, in the area of fraud detection, finding the anomalies in the data patterns. And there are a lot of other applications. You can find the scams, medical claims in the identifying fraudulent insurance claim. So you think about some applications, there are n number of ways by which you can use big data and its analytics for getting the benefit for the specific areas in the healthcare domain. Now, there are some key AI techniques which are used in the healthcare big data analytics. Some of the areas I'm currently working with. Now, Dr. Dey has already spoken about, I'm not getting into more detail about this machine learning and this. I'm just telling how big data is used where the machine learning algorithm can be used. One of the use cases predicting the patient's readmission based on the historical data in a hospital. So if you have the patient data, based on that, can you do some sort of prediction that how that patient is going to come back? Now, I'm not talking about any financial model. I always believe that, sorry. Hello. Am I audible?
Yes, Professor, please go on. You're audible.
Correct. So what I wanted to tell you that any AI application should make some impact on certain areas. And whenever we do any AI applications, I ensure that, we define certain KPIs, key performance indicator, measurable in terms of its success, in terms of its performance, in terms of its results. This is very important. Without that, you cannot achieve what you are desiring to. So you can use natural language processing, extracting insight from the unstructured clinical notes. We can use NLP algorithms. I saw, I think some doctor there, he has written that, all this today's, these applications, LLM-based applications, these are all based on NLP algorithms, where we are not storing the data in a structured form. These are unstructured, semi-structured data. But the beauty is that we can take the structured data into an NLP model, or we can take it to any sort of GPT and use and extract intelligence from there. So what I generally do, I will explain you what I generally do. So I use enterprise data, enterprise application data, and I also create synthetic data using the GPTs. Because if you create synthetic data and merge the synthetic data based on certain prompt engineering techniques. So I use a lot of prompt engineering, which helps me in creating a lot of synthetic data. I combine the synthetic data with the actual data and then apply that in training the model. And that's a continuous process, So what I want to tell you that here in the big data analytics, we use in the natural language processing, in the deep learning, the very interesting subject. I love this. So CNN, and so we use this detecting the tumors in an MRI scan with a high accuracy. Now, how to do this? How to train the model? Now, when I'm considering training the model, so I'm using MRI scan data, image data, and along with that, I have also embedded the text data about patient data, name, age, medical history. So there are a lot of independent data variables which can also help us in building certain model, which can give us a lot of insights about the patient. I'm taking the MRI scan data, is the image data. Along with that, I'm also taking the demographic data of the patient, which is the facts and figures and the text. And also the interactions, when I'm interacting with the patient, I'm asking something, I can record the discussions, the voice data. I can also consider the voice data in my model. So predictive analytics, you can also use the big data in predictive analysis in the healthcare application, forecasting the disease outbreaks. This is a public health related, I did a small public health related projects with one of large hospitals. They have a public health department. And of course, with the real-time analytics, which is now coming up, monitoring the patient vitals in the ICUs. Here, continuously, you are taking the streaming analytics platform and also the data coming from the wearable devices, and of course, alerting the doctors for the critical changes that is happening. Now, these are the applications which are based on big data. Now, how we are using the algorithms to extract, this is not in my today's sessions. We can discuss later, or maybe somebody will be talking about that. Now, in the entire workflow of using this big data, the most important, there are a few steps. First is that we collect the data. We do some data pre-processing. We clean the data, normalize the data, and then we use some feature engineering. Now, feature engineering is a very interesting, subject. So sometimes the feature engineering identifies the key features such as age, medication, adherence, I've just written. So you can create feature engineering, use feature engineering to create data by some computation also, by using some algorithms. And that will help you in enhancing the accuracy level. There are a lot of non-medical application which I am currently working on for large companies, 10,000 crores group. So I use extensively feature engineering before I take them to the machine learning or deep learning algorithms. Then of course you need to see the model selections and training. Some example like random forest, XGBoost, LSTM, so there are multiple. And never ever we should follow only one algorithm. We should use multiple algorithms, and whichever will give the best fit output. So there is a cross validation. There is a technique which is called cross validation of algorithms, and we consider the best fit. And then based upon the training of the data and the output that we get, we need to see that, which model is giving the best results. And then model evaluation and deployment. Now, these are the stages that we follow. This is a workflow, data workflow, big data workflow in big data analytics in predicting hospital readmissions. So whenever we do, there are challenges that we need to face. One of the important challenges, the data privacy and security, which I have faced quite a lot. And now the new data law has also come. Data integration, another big challenge, combining data from disparate sources in an unified format, very difficult. Scalability and interoperability. There are many challenges. I found that these are the 4 important challenges when we work on a big data analytics in healthcare. Now, I will stop any questions. If you have no questions right now, let's take some multiple choice questions. I will request anybody is interested to answer, please unmute yourself and say that which is the correct answer. First one, what is the primary purpose of healthcare data analytics? Anybody, please unmute and
B. Improving patient care and clinical decision making.
correct, 100% correct. Thank you. Can we take the second question? Which of the following is not a type of healthcare data?
Weather data.
Yes. Okay, the 5 V's of big data include all the following except.
Visualization.
Visualization.
Right. So I'll tell you, medical data visualization is another very important area. So I always work with a company which is based in US. So they help us in doing medical data visualizations, and the entire team there are all doctors. And Indian doctors, they have settled in US, and their major focus in medical data visualizations coming out from multiple AI applications or clinical trials or any other things. Okay, takes the fourth question. What is the role of AI in real-time monitoring in healthcare?
B.
Yes, correct. Tracking patient vitals using wearable devices. Excellent, super. So let's take the other few questions more. Which technology is primarily used for storing and processing large data set in a distributed manner in healthcare?
Hadoop.
Hadoop.
Now I think all of you know Hadoop is a distributed way of storing the data. If the data is big data and having all the 5 V's as an attributes. Okay, move to the next one. Which of the following is an example of AI-driven predictive analytics?
A.
Correct, 6. Predicting flu outbreaks based on the public health data, right? So these are all predictive models. So we use a lot of algorithms. Now, I wanted to tell you here at this point, now, should I use a AI model or should I use a statistical model? Or should I use a biostat? Now, I have done a lot of work on using biostat. That time the AI was not, there. But today, people have started using AI, developing a model, training the model, 80-20, 70-30. 80% is the training the model, 20% is testing the model. Sometimes, the model gives, underfit, overfit. So there are a lot of things. But earlier days, we used statistical technique or biostat for doing this, predicting this outbreak of flu by collecting or processing the data. Okay. So question number 7, yes. What is the primary benefit of using natural language processing in healthcare analytics?
Extracting insights from
B.
unstructured clinical notes.
B.
B.
Perfect, correct, 100% correct. Now I think all of us have understood. Okay, great. Which AI technique is commonly used for analyzing medical images to detect disease?
A.
CNN and B.
CNN.
Convolutional neural networks.
Yes, CNN, convolutional neural network. Image. I will sometime and I will explain you on how we do and how I use the MRI data or X-ray data. We have also worked on a X-ray AI, chest AI, where we are using the X-ray data. And okay, 2 more questions. How does Spark differ from the Hadoop in healthcare analytics?
A.
Yes, excellent, super. Spark helps us in real time, whereas the Hadoop uses batch processing because it is a distributed thing. Okay. Now, based upon the type of application that AI application in healthcare you'd like to do, where you are using big data, you need to consider which technology you should use. Technology selection is also very important because your entire model will work on data. And yes, so very important, sir. I'm telling you, it's very, very important. And we struggle a lot in terms of deciding this. And a lot of time, that application, NeuroSilt, is an application. It is a cloud-based application. Is analytics as a service, medical analytics as a service model. It uses SaaS because subscription model. The doctors, or sorry, the hospital, medical colleges, they pay on a subscription model. Now, if somebody asking me that, I want this entire application to run on my on-premise, I initiated the discussion with West Bengal Health Department. They said that we have 20, 30 plus, hospitals who would like to use this application. So can we do it here on-premise? Because our data is very sensitive. So I said there are a lot of investment, it will go in crores, because see, we are using the cloud. But if I do it in on-premise, so on-premise, one is that investment in terms of the infrastructure, computing infrastructure, then maintenance. And it's
Sir,
available 24/7 by 365 days.
sir, in the cloud, can it be secured, that data on behalf of the
Yes,
hospital?
sir. Yes. So there are a lot of other technology that we use. That's called, this one is called hardware technology, storage technology. Another is called your application technology, data technologies. Okay.
Mhm.
So nobody knows that this particular MRI is whose MRI data, but only, the diagnostic center or the radiology department of a hospital or a
Mhm.
medical college, when they are uploading the data, they know there is a secured way of uploading the data, and within 5-10 minutes, the radiologist can see the entire, the report analysis on the screen. So that's the beauty. But again, there need to be an awareness. Okay, people have to be aware. So I had a lot of experience of explaining this to the neurologist, neurosurgeon, and plus, the radiologist. Good experience. So what is the key challenges in the big data analytics in healthcare? The last
B.
question, number
B.
10.
B.
Ensuring data privacy and security. This is the problem which I have faced in many hospitals in Calcutta, in Delhi, in Chennai, in Bangalore, and because it's a mental health related data, so a lot of security. But we use Indian brain data. So Indian brain data. So our model is trained on that. So that's the advantage of this. So with this, I would like to stop here. I hope, is it clear that what is big data and the importance of big data in the healthcare AI applications? Any questions?
Thank you very much.
Thank you, sir.
Sir, in India,
Right.
most of the HMS and EMR
Yeah.
are one, basically in India, none of the clinical specialties are using national level of clinical protocols.
Correct.
Number two, EMR or HMS, none of the EMR or HMS in India is using computational clinical data.
Computational clinical data. Yes, correct.
Yeah,
Right. I agree.
right. And
Right.
number three, basically, there is lack of awareness of health informatics and data sciences within the medical fraternity.
Agree.
Now with AI, there is a lot of physician involvement in understanding digital health.
Agree.
Right, sir?
Yes, yes.
Now, my challenge is basically what will be the impact of health system using health informatics, because that is the base of whole thing of digitization the health record, and health system which are not using the computable data or protocols like in India.
So there are certain, the government has initiated certain uh, process, and I understand that, there is an organization called CDAC.
Yes.
So CDAC is given this responsibility from the ministry to build this framework, and they have already done something. While we were implementing this, our product, so we have presented our system to them, and there were some advices that came, because they are also not, so they are policy, formulation people, but there are a lot to work, lot to be developed. I agree. These are,
And sir, number two, basically,
yeah.
the health informatics. So there is a lack of awareness within the medical fraternity about the health informatics itself, and where whatever ecosystem India has developed till now.
Yeah.
So basically now everyone thinks AI is the panacea, but it is
No.
work in progress, which I
Yeah, yeah.
understand
Correct.
it basically.
Right.
So basically, increasing health informatics knowledge base, data sciences and analytics should go parallelly apart from AI education.
Yes, yes. So that's the reason I said that small data, big data, and sorry, small data, medium data, big data. First, if I'm having this, healthcare informatics, so can I use some, some sort of, predictive model using statistical techniques? That
Yeah.
government, every state government, the procurement of medicine for their government hospital is a very complex process. I interacted with the West Bengal government director health services, and in fact, my cousin brother, he's a CMO in West Bengal government. I have interacted with him also. It's a very complex process. So how do you use some sort of intelligence applications to do it in an effective way? I don't know. I'm not setting up any target or any sort of success measures, but how you do this? If you go to any of the medical colleges, you see the processes there. There are a lot to do. And if
Yeah,
you
sir.
start thinking of implementing AI there, it will take time. Yeah.
Sir, it will require business processing, re-engineering, and change management.
Yes,
First,
yes,
basically, that
100%. Because
without
so
BPR
that's
and change
why we have
management, it
initiated
won't be
this.
able.
Yeah.
We won't be able to implement this solution like that.
Right. Right.
So, Professor Gupta, fantastic presentation. And also to
Thank
answer
you.
the question of Dr. Taneja, I think
Yeah.
it has to start with data and digital literacy in the clinicians. And I
Yes. Yes.
think we had Dr. Chakraborty here asked a good question that, where will this data going to be stored? And this is why I posted there that there are various types of clouds, like the public cloud, the private cloud,
Private clouds,
and
or you
the
can have
hybrid cloud.
on-premise also. Yeah.
Yes, you can have on-premise data storage. So where is the inertia in the clinicians? Now, say for all of us who are tech literate, AI literate, members of the community at Doctors AI, we understand how the data is flowing, the flow of the data system. But for most clinicians, they don't have an idea is that if I enter a number or a string into a system, where exactly is it going?
Yes.
And this becomes the biggest inertia of data sharing. So unless they have the literacy and understanding that where and how their data will be stored, who has the access to it, who is the owner of the data, and how is the data flowing, the acceptance of electronic health record system or the acceptance of digital informatics or health informatics won't come. So this is exactly where I feel that there is a start, our
Yes.
digital literacy, our AI literacy, and it is like, we learn and we spread to the others, and it goes on in a ripple effect. And eventually, with ABDM coming in, Ayushman Digital Bharat Mission coming in the couple of years, I believe, every medical professional will have to use an electronic health record system. But again, that usage has to come with literacy. So you should know how the data is flowing. What are the grades of security that the ABM compliance that the EMR tool that you're using is using? Where is the data is getting stored? How much of it is within your access? How much of it is in the access of the developer? How much is in the access of the patient? So all that literacy is very important from the healthcare provider point of view also. And then the acceptance will definitely increase.
Correct. Correct.
Thank
Yeah.
you, Dr.
Mm.
J.
Can I just
So,
come in, Dr. Day?
Please, sir.
Sir, yeah, one branch which is very important is clinical informatics officer. So
yes,
somehow,
chief
because of the
clinical,
lack of
yeah.
basically
So,
understanding of the health informatics,
right.
somehow physician are basically lacking that particular insight. But one very good thing which is happening is that more and more doctors are getting, because of AI, involved into the use of digital health for improving their clinical outcomes, basically.
Correct.
But then this health informatics needs equal emphasis while doing this AI learnings.
Totally agree. And we should also remember equally, no matter how much of AI we talk about, the foundation and the fuel for every AI model is going to be data. And it's going to be
Perfect. Correct.
that, yes, and it is going to be that data which is available, which is visible to us, even if it's unstructured. But if we don't enter the data in the forms of numbers and strings, then it is very difficult to build and deploy an AI model out of nothing. So for each one of us, who are planning and thinking of working with data, working with AI, foundation should be digital literacy. Foundation should be, starting to use and putting everything on the record. That's more important. Even from medical legal aspect, think about it. Putting everything on the record is so very important as you practice. So each one of us must have an electronic health record. And again, you can do it on the premises like Professor Roy Gupta spoke about. But again, if you are using a date, for example, a health record system which is say 8 years and 9 years old, and you have say 17,000 patients, like I have 17,000 patients on my electronic health record, it is impossible for me to store it on any local system. So you have to go cloud based. So again, when you go cloud based, you have to understand that your EMR provider is providing which category of cloud based. Is it the AWS? Is it Google? Is it, what are they using, and what is the category of the cloud they're using? How is the data flowing? So all this literacy will be very, very important for us to start from the scratch. And I think we are all doing it. I hope every one of us who are in this virtual room is using some form of electronic health record. If not, that is the first change. They say charity begins at home. That is the first change that we need to do. Start
Dr. Dev,
documenting everything in EMR. Yes, Dr. Chakrabarti.
In
one
standalone
question is my electronic data is stored by Practo Cloud.
Yeah.
Okay.
So, yeah.
Now my question is that I have the access of that cloud. The Practo people, are they have the access of this cloud?
Yes, sir.
Yes,
Now,
sir.
this is
Yeah.
where the literacy is very, very important. So when somebody is developing an AI EMR, they are the subscriber to the cloud, and they are providing you access not to the cloud, but they're providing you access to the user interface. So they have built the user interface, which is your EMR, which you are having access to. I'm not sure you have access to their cloud. You have access to your EMR. They have access to the cloud. Now, where is this question of trust and uh, understanding comes in? Is that how are they going to be using the data which you are entering in the EMR through the user interface, which is stored in the cloud? Now, usually the clouds, as I said, they use the hybrid clouds. Most of the people are using the hybrid cloud. So they have multiple layers of security in these clouds. And usually the data in these clouds are encrypted to some extent. But then again, you have to see if that cloud or if the system is HIPAA compliant. If not, most are, but if not, then there is an issue, because the HIPAA compliance is important in terms of medical health records being stored.
Yeah.
Now, the understanding that you should have, and this is important because I started using electronic health record in my practice from the year 2015. AI was not even in the picture, and most people used to like kind of smirk at me, what the hell are you doing at the computer and a printer in your clinic? The point is,
I also
yes,
started since
but
2013.
the point is, the electronic health system which you are using, there should be an understanding between you and the service provider, which is usually should be in the form of a legal MOU, as to how you are allowing them your data to be used. And this is what is important for the user to initiate this. Most of the service providers do not sign a MOU with you. Even say, for example, if the data is on the cloud and your data is being extrapolated by another third-party system, like for example, I should not name, but let's say IQVIA, just giving an example, okay, who is extracting data from that cloud for doing research purpose. Have you given permission to it? You may not have given permission to it. So in this case, there should be agreements being signed between the healthcare EMR provider, the EMR user, and the group which is extracting the information from that particular cloud. And that's how the flow of information should be happening, and that's how it should be legally bound. But again, who is going to ask that question, that what is happening with my data, unless you are literate about it? So this is where the literacy of the clinician is very important, who is using it. So going forward, this is what we should ask our EMR providers to do.
Okay, thank you.
Correct, yes.
Dr. Komal had a question, I guess.
Regarding the standalone clinics, which you actually just spoke about, that the EMR providers need to be more transparent about basically doing it. They come, they install the software, and they say, your data is just locked with you. We are not accessing the data. But at the end of the year, you get to know it's spread everywhere, basically.
Yeah,
So at the end of the day, you're not very comfortable
exactly.
writing electronic prescriptions. So you just answered it before I could question.
Yeah. So again, so this is a chicken egg situation. Trust me, Dr. Komal, this is a question. I mean, even as we speak with 35 of you doing this AI course, trust me, the usage of EMR in our country is only 4% of healthcare professionals use it. That's the number. 4 to 6%, I think, is the latest survey result. And the sole reason for the 94% of not using it is this exactly what you said. They are not sure where the data is going. And this is why we need Ayushman Digital Bharat mission with levels of security at every step. Because the end of the day, neither the service provider is the owner of the data, nor the doctor is the owner of the data.
In that case, the
Patient is the
government
owner
will
of it.
use the data.
Yes, the doctor
Right?
can use the
The
data, but
central government will get the data.
Doctor should get the data as and when required.
absolutely, totally
It is
agree.
basically
But
the patient who is the owner of the data.
yes, the patient is the owner of the data. The ownership of the data lies with the patient. So this is what ABDM is going to bring in. So when you are asking the patient to share a certain code and then you have access to the electronic health record, it takes one layer of security and then the patient is giving access. So this is where the transparency will be required. Parallelly, the medical fraternity gets to get more and more, needs to get more and more literate and aware of this. So next time
When
the EMR provider comes to you,
the
Dr.
owners, if
Komal.
it owners, if, sorry, please go
Yeah,
on.
please go on, Dr. Komal.
The onus when it falls on the patient, I think we are going to be more safe with our records because they are the ones who lose the records.
True, agree.
Yeah.
Here, if the patient, basically, if the EMR provider also provided PHR, then that problem can be solved. The patient personal health record can be had with the patient himself, basically.
Yes. And this brings to the question of data interoperability. Maybe Professor Pankaj
Yes,
or
yes.
who is
I'll
going to
tell
be
you,
taking.
let's suppose,
Yes.
see, whenever any, patient, they claim the medical insurance, the hospital, they share the entire data with the insurance company. Do we have any control over that? Is that company sharing the data to the other third parties? We don't know. So how do you
Yeah.
ensure
Yeah.
their
So that's what.
operability? Yeah.
Yes, that's where the interoperability should come. And when you
Perfect.
talk about interoperability, maybe Professor Pankaj can explain this next time in
Yeah.
one of the section where we speak further on data, is where the data points need to be mapped 1:1. And that is so very important because otherwise we'll end up losing the data. So it's like, mapping one point with the other point in one interface versus the other interface.
True.
Again, this is an important part of ABDM compliance, where
Yes.
even if you're using, for example, Practo or you're using HealthPix or using One Glance or whatever, I'm not preferring any one of the other. I'm just taking random names. If I am accessing through EMRX and Dr. Chakravarti is accessing through EMRY and Dr. Komal is accessing through EMRZ, then the same data point should be interpreted in each of the EMRs in the same, sections. So the BP should have the number, the weight should have that specific number. So one-to-one mapping must be coming. At the moment, because this market is a little kind of I would say, a closed market at the moment. So every EMR company, they want to play this as their USP. And they don't want to share this interoperability or this inter mapping kind of a thing. So it'll be very difficult. Suppose you want to move from, say, X to Y, it'll be very difficult for you to port your entire data to the other. You will eventually lose some data or mapping will not be accurate because it's the USP of which they want to keep the secrecy of this thing. And it is how healthcare industry, it is how the digital world industry works. But ABDM will solve all those problems. And I'm sure in the years to come, all of us will have to use electronic health record because that is coming in. The insurance companies are going to come in a big way on with the health record. So we all must be, literate about using this digitalization of the medical records. That is
Correct.
going to happen. And once that happens, we all will be sitting on tons and tons of data, meaningful data. That meaningful data will give you information. And from that information, now when you have access to that data, you will be able to derive that intelligence, which is far, far richer than the evidence that you read in the book, because that is real time, demographic driven, your practice driven, your patient pool driven, intelligence based understanding of the trend or of the pattern. Imagine the power of it, and that will help you take better decisions. So imagine that kind of a enabler in your clinical decision support system added with your EMR, which can actually guide you in a more nuanced way of solving the clinical cases when the patient is in front of you in real time. So that is where the enabler of AI will help us over and above the digital records. But yes, the digital literacy is absolutely the key, which Dr. Taneja rightly mentioned. Totally agree.
I think we
Okay.
can, any other
Yes.
questions, or we can
We
stop
have some
there?
comments coming in. Does anybody want to also unmute, ask any questions? So going forward, yes.
Doctor, yeah, Amit, you were talking about that EMR vendor ABC. Basically,
Yeah.
the biggest challenge is because we don't have computable clinical data. Once that computable clinical data is made mandatory,
Yes.
interoperability will become easier.
Absolutely. Totally agree, sir. Totally agree. So I think it's just a matter of when. That's it. I mean, it is going to be there. It's just a matter of when it's going to be there. So best is we get ourselves prepared.
One small question to you, Dr. Amit, basically. In the absence of national clinical protocols of various specialty, how it is going to impact whatever we are talking in terms of digital health?
So that's what I said. I personally believe this. The way you see any, say, authoritative body, whether it's a government or a non-profit organization, providing guidelines of the ways of practice or the standards of practice of any particular specialty, is largely driven by RCTs, meta-analysis, and very much inclined and driven by pharma, whether we like it or not, right?
Yeah.
When the real-time analytics are going to come in, you're going to be looking at research with a bottoms-up approach. And this is something which we will discuss in the upcoming classes, that the evidences of research, the strength of evidences of research, which is RCTs at the top, and then meta-analysis, and this and this, and then comes your case control study, the real world study. It's just going to be the other way around. Your real world observation from your EMR will be much richer than the inference drawn out of the RCTs, and it can be dynamically changing. So the guidelines can also dynamically evolve with the real world experience of the doctor. I think that will really bring a complete shift in the way we have been perceiving evidence-based medicine. But as I said again, in the beginning, all that we need is data, and data, understanding of the data, deriving information or meaningful information of the data, and from there we can develop that intelligence.
One more small query. In the absence of computable clinical data, how do we implement basically clinical decision support software, basically?
So at the moment, most of the CDSs which you see are being built over open source data.
Yeah.
Yeah, and that is a big limitation because the data is skewed. It's not demographic specific. It's not ethnic specific, etc., etc. So this is where we need, say, for example, in India, we need small language model of a particular specialty, which can actually, one foundation model of one specialty can actually help hundreds of people to develop hundreds of CDSs based on that particular specialty. But that has to be homegrown on our data. That's the need of the hour. That's what people are thinking, that the open source data in healthcare is not enough. You need your regional data to develop your clinical decision support system.
In fact, I was talking to one of my very good doctor friend. He is associated with a hospital close to mines, coal mines. And so we are trying to develop some application that what are the type of diseases that the people they get when they work inside a mines, whether it is the open cast mines or closed mines. So we were now started arguing that from where we'll get the data. So I said the best source will be that catch hold of the hospitals which are close to these mines, because there are doctors. But then when we checked up with them, there was no digital data available.
Exactly.
It is a pathetic thing, And
So,
I'm talking about some Tata group of minds. And
yes.
I'm an ex-CIO of that one of the Tata companies. So I understand that, so there are a lot to do, I think, for a country like India.
And I'm sure all of us in this room,
People were
all
saying that
clinicians.
can't we not put some sensor inside the mines where the people are, mining?
Yeah.
Now from that, can I develop a predictive model that what type of diseases is possible? Because they're inhaling a
Yes.
lot of gases inside a mines. So how that inhaling of gas can make an impact on their heart or their other, systems. So how do you predict?
Absolutely. Absolutely.
The challenge
Also,
is the data.
also in that cough, the type of cough they are doing, like in
No,
So
I've
this
seen,
is,
they
yeah,
get TB, then heart problem, then,
yes,
eye problems. But this data is not there. The hospitals have not captured the data, and the doctor who have prescribed the medicine, they have also not captured. They have not stored that prescription data. So how do you create a model? So now if I start now, so that means I will not have a big data. I will have a small data or medium data. But I
right,
need to start from somewhere. And that's
right.
a lot of opportunities, lying where the people have now started understanding the need, and the data can help.
So the take-home points for the day, I think we have to wrap it up before 8. That's where the meeting will automatically end. So before that, quick take-home points. We have understood the overview of AI in healthcare. I have taken you through an understanding of intelligence, which I always feel that as the intelligence segment of the society, as doctors, we must analyze intelligence first before we start applying artificial intelligence and reasoning, learning, etc. We've given you some introduction to some terminologies which might be overwhelming to all of you, some of you rather. I will recommend you to go back to the recordings, hear them again. A fantastic lecture by Professor Pankaj, where he has beautifully described about small, medium, big data and the role of big data analytics. It's a start. We will get more in depth of big data analytics and healthcare data analytics in another module with him as we go along. Good question answer session. So going
Yes,
forward,
excellent session.
yes,
Yeah.
we will be sending you some reading materials based on our presentations over the next couple of days. Go through them, create an audio podcast of it, listen to it while you're driving, be innovative, use generative AI as much as you can to augment the learning skills. And going forward, next week, we will be coming back on Saturdays and Sundays with 2 hours of learning each of the day, and you can figure out the topics in the course agenda which we have floated in the group. Meanwhile, I will request all of you to keep that the curious quotient completely high. Be curious, be adaptive in this particular learning sessions, and keep on discussing this throughout the week. I mean, learning doesn't end today, so drop your questions in the chat box, keep on chatting with each other. uh, Drop your comments, bring in new thoughts into, tell us more, what more we could have told you also, because we, as I always keep saying, we keep learning from each other during
Correct.
this
Correct.
whole curriculum. So thank you very much, all of you, for joining in. We had uh, thought of doing it for 2 hours, but with all of your encouragement and enthusiasm, I can see we stretched up to 3 hours. And apologies from my end for joining in 10 minutes late of some network issues my end. Have a great remaining of your Sunday. Just spend some good time with your family, and let's get back fresh next week for the next module. Thank you and good night, everyone.
Excellent. Thank you. Thank you, everybody. Yeah.
Good night.
thank you for wonderful sessions.
Thank you.
Thank you. Thank you.